So you've treated yourself for thrush and more thrush, and you still have a problem with thrush. The pharmacist doesn't seem to have anything else to offer you. Now you're stuck. Good day, I'm Dr. Tia, and today we're talking thrush or Candida vaginitis, because the most common fungus that causes thrush is Candida. What is thrush? Thrush is an overgrowth of bacteria that happily usually live in the vagina, but then usually something sets them off and then they multiply and take over. The most common fungus is Candida. There are other funguses though. And when Candida takes over, it tends to cause symptoms such as vaginal discomfort. That could be just at rest or during intercourse, just a bit more fragility of the vulvar skin. Candida can also result in a white cottage cheese-like discharge in underwear that often has no smell, just a lot of discharge. The most common presentation is actually with itching and burning of the vulval region. And there can be inflammation of the vulva, which causes pain during intercourse, pain with wiping after urination, pain with urination or dysuria. The most common risk factor for thrush is immediately post-antibiotics, because when you kill bacteria that were keeping the fungus at bay, then suddenly the fungus takes over. So it's not an uncommon side effect that people will be treated maybe for a chest infection or some infection elsewhere with antibiotics, and then they will a few weeks later report that they have thrush. Some people are more prone to having thrush due to the medication they might be prescribed. Commonly an SGLT2 inhibitor, which are medications that we use for diabetes, help the patient get rid of excess sugar through their urine, which then means that area around the vulva is very sugary and sweet, which promotes fungal replication and multiplication, resulting in thrush. Some people notice they have these symptoms at certain times of the month. Hormones play a role in how you manage the microbiome or the layout of your bacteria, fungus, etc. If someone was to use harsh soaps, chemicals to wash the vulval region, and then also not wear cotton underwear, which actually has a breathable nature, it just creates an environment of humidity, which then increases the likelihood of having thrush. There are many what I call thrush masquerades. So some people will present and they think they have thrush, but they have other things. So it's worthwhile taking an adequate history and exploring differential diagnosis, such as bacterial vaginosis, which is an overgrowth of certain bacteria to the vulval region. Some people have herpes. Some people have skin conditions such as lichen sclerosis or dermatitis, which can often be missed. And you have patients who are like, I've had thrush for 3 years and no one has ever looked at the vulva or the vaginal region, and you find that actually this person has extensive lichen sclerosis, or they even have cancer of the vulva, and it's all because they've been presenting as thrush and no one's bothered to examine them. Treatment for thrush is often really simple, and yes, you can self-treat with over-the-counter medications such as Canesten, which you can use as a 3-day pessary course or a 6-day, whatever you pick. Just make sure you complete the treatment course. If your partner is male and they are not circumcised, it might be worthwhile getting them to take the oral diflucan-1 antifungal to just make sure they are not harboring thrush fungus under their foreskin and consequently keeps sharing it back with you. And as already said, using a soap-free wash and wearing cotton underwear certainly goes a long way in reducing the humidity and reducing the risk of having thrush. Hope that helps. Till next time.